Assalamu alaikum wa rahmatullahi wa barakatuhu. Alhamdulillah, today I have had the opportunity to come here to the dental practice, my dentist in Halifax. Alhamdulillah, Rabbil Alameen. Dawateislami, a global organization, would like to make an awareness to our young children who are under the age of 18, who are studying in school and colleges. Many researchers have found that the smoking of vape pens causes lung damage and cancer as well. And due to its sweetness and flavor, damages the teeth very quickly, like coke decays tooth within hours. The addiction of vape pens is increasing in schools uncontrollably, and schools are struggling to deal with this matter. Recently, we discovered that these vape pens, it has over 30 different chemicals, and not only that, students are mixing addictive substances as an add-on, which is causing overdose and even making students collapse to the ground. Another news article shows that young 13-year-old smoked a vape pen at school. She was rushed to the hospital as she was unable to breathe, and she nearly died of it as well. My visits to some of the shops in Halifax showed me some concerns that the shopkeepers are selling these devices to young children without any identification. When asked, they continued to blame other shops and would not take the blame. There was an occasion I followed someone who I know to the shop, and this individual was about 14 years of age. As he left the shop, I noticed he threw the packaging into the bin. I investigated and noticed that this product is for an adult over 18 years and contains 100% nicotine. I went to the shopkeeper and said to him, "Why did you sell this product to a 14-year-old child?" He refused to answer. I gave him an example. What if I sell this to your child? How would you like it? He said no. Then he apologized, and I was deeply disappointed and hurt in my heart. Our children are not to blame. It's the shops who are selling these products to our children, which is a big problem. And there must be a ban on all vapes. But the response of our council and governments are not taking this action. It will be too late if they made all our children addicted to this substance and then make a national ban. They will go hysterical and crave for them, which would cause anxiety, depression, and behavior issues. They will fail in their education, which is happening already, as we can see. Another awareness, shops opened as smoking lounges in our local areas as well. We see this everywhere. Smoking Shisha is like smoking 300 to 400 cigarettes in one cartridge, which is also a health hazard as well. Police and social services will not take any responsibility to deal with the sales of these products to young children. The advice is that to contact trading standards. This is the solution, they said, but I'm quite disappointed in the response. We would like to request all Muslims and non-Muslims to make awareness and to help our younger generation to stop smoking and help and support them in these difficult times. Today, Alhamdulillahi Rabbil Alameen, by Allah Almighty has given me an opportunity to visit one of the doctors, Dr. Asif, as you can see on my right, here at my dentist, to seek awareness and what they have seen in patients who have been smoking vape pens regularly and what treatment was given to them. Let's learn and educate ourselves. Maybe this will be the turning point of our life, of our bad habits that we are taking these vape pens. So I'd like to thank Asif for giving me this opportunity to come here. So inshallah, we'll ask this question to Asif Bhai and see what kind of response we get.
That's fine. Okay.
Shall I just go into
Yeah,
more
you
detail?
can.
Okay. Assalamu alaikum.
Introduce yourself.
Yeah.
Yeah. So your name and where you're from,
That's fine.
and what your job is here.
No worries.
Okay.
Assalamu alaikum. So my name is Asif and I work as a dentist, mainly a private cosmetic dentist. I'm actually from Huddersfield, but I work in Halifax, and I also work in a different practice in Brighouse. But more of my focus is on like cosmetic treatment. I try and transform people's lives. So when they come in with like really rotten, decayed teeth and they want to transform their smile for a wedding, could be a graduation or something special for that person. And what I do see quite often is the damaging effects of cigarettes, e-cigs, anything with tobacco and nicotine. The main issue that I'm having to deal with now is the younger generation who are now having a lot of consumption when it comes to these e-cigs or vapes or whatever you call it. If you go back in time, it was always cigarettes that people would consume, and everybody knows cigarettes to have the substances nicotine, which is highly addictive, and tobacco. And everybody is aware that if you smoked, you'd have smoker's breath, they would call it. So you'd have like a lot of like brown staining on your teeth. You'd have bad breath. And as an alternative, what people have started to sell now are the e-cigs and the vapes because they think that it's an alternative solution. It's not as bad. It's not as damaging. And based on that, a lot of the youth are now starting to buy it because they believe that with the marketing behind the e-cigs and the vapes, it's not going to be as damaging. But a lot of people fail to remember that in vapes and e-cigs, you actually have nicotine and tobacco. Again, you still have that highly addictive substance and you still have tobacco inside of it. Because of the sweet flavors and the smell and the smoke that comes out of it, it's become more for social media sort of hype that people call it. But what I'm seeing now is younger generation coming in, older generation as well, rotten teeth, severe gum disease. And severe gum disease essentially is where your gums become extremely weak. You're bleeding all the time. Even just touching the gum is just bleeding. People are struggling to eat and drink. The teeth are getting really wobbly. Eventually, these wobbly teeth will end up either falling out themselves. So, for example, they're in the middle of a meal, or they'll have to come to the dentist because it's severely infected or the gum disease has gotten really, really bad to the point where they're unable to eat or even bite into anything. This is something that I'm seeing increase on a daily basis. It is very, very, very difficult to manage something like gum disease. If you're not familiar with what it is an irreversible problem in the oral health. So if you don't manage this earlier on, if you don't cut out the vapes, the e-cigs, the smoking, you're going to end up at a younger age losing your teeth. And there's nothing worse than losing your teeth. A lot of people don't want to look into the future. They think, look, I'll worry about that in 10 years' time and, I'll deal with it. But what people fail to see is I'm seeing early 30s, 40-year-olds coming in. They're having dentures. And dentures are those fake teeth, the false teeth that you'd commonly seen all the older generation have. But now you're seeing the younger generation having dentures. You can't eat, you can't drink, you can't go about your life as normal. You actually lose weight. And mentally, I've seen people get depressed, anxiety, and then they want to transform their smile, but now you've got no teeth because of the severe gum disease, and it's going to cost you so much money, it's so much effort, so many appointments with a dentist, and it does take a lot of time. So people that are coming in that are going to graduate or going to get married or whatever it may be, something special in their life, and then they're looking for a change in their smile, but this change could have been done from an earlier age, but they left it too late. That's one side of dentistry that's affected, which is the gum disease. But even the flavors and the sweeteners and stuff like that that's added into these e-cigs and vapes, people again fail to see the side effects of this. Anything sugar related is going to decay away and erode away your teeth. So if you're consuming this on a daily basis, and you've got to remember with an e-cig and a vape, it is very easy to just smoke and take a puff like every 2 minutes of the day because you've got it in your pocket. You just think, I'll take a puff and it'll be all right. But that constant consumption is just eating away at your teeth and your gums constantly. And one thing that I'm dealing with now is finding it so difficult not to just manage it, but to get people to stop doing it. And because of the nicotine in these vapes and e-cigs, once you become addicted to it, it's very, very, very difficult to then stop doing that. This is just oral health I'm talking about. When you actually talk about the full body, your lungs causing COPD, asthma, just all these problems that is linked to, it will deteriorate your health. And if you're someone that enjoys sports, activities, even just going for walks or whatever it may be, it will really, really have an effect on your life. So I think if you can prevent it, if you can stop it from an earlier age, 100% stay away from that stuff. And, inshallah, you'll see the benefits to your health.
MashaAllah. Quite in detail, Dr. Asif has
Jazakallah.
tried to make some awareness for our youngsters. So I'd like to thank you once again. So inshallah, Asif Bhai, as you know, we
Inshallah.
have the weekly Sunnah inspiring Ijtimas of Dawateislami which take place every
Mhm.
Thursday at 8 p.m. I'd like to request, inshallah, to invite
Inshallah.
yourselves to come and join us. We have basically recitation of the glorious Quran.
Mhm.
We have Naat Sharif, praises of the beloved Prophet Sallallahu Alaihi Wasallam. And we have a reminder, mashallah, like a reminder you've given today of awareness, and then a zikr and a dua. And we obviously have a refreshment at the end, some food, which all the brothers enjoy. So this is some steps you can take. If you have these bad habits, we want to, like make this awareness as well, and we want you to come closer to the Deen as well to perform your salah. And we obviously, Dawat Islami's organization, we travel for 3 days. We educate many Islam brothers as we can to rectify the cleanliness. One part is your teeth as well, using the miswak sharif as well. So doing the correct wudu, ghusl, and inshallah to prepare and to become better Muslims. So, and the last and final to finish off, do keep watching Madri channel, Sky 746. Inshallah, this is a good source of educating oneself of Islamic knowledge as well. And the more closer we come to the Deen, inshallah, the more awareness we'll have regarding these things. And like I said, Allah's given me the opportunity to meet this brother. I've not met him before, but it was nice to hear his conversation. And I'd like to meet you again at some point.
Inshallah. Jazakallah for giving me the opportunity.
Shukran. Take care and keep watching. Inshallah.
Inshallah.